when Americans are asked, would you favor a Medicare for all type health care system in which the government would be the insurer, you get 60, 62%, 64%, generally around two-thirds of the people saying yes. And polls of physicians have said about 60%. So what's the problem? Why are we constantly being told, oh, this is not politically feasible? Well, I think most of us probably can guess the answer to that. It's not that the people aren't for this. It's that the powerful insurance interests and their cohorts, the banking industry and others in the finance insurance, real estate, and in big pharmaceuticals, they're lobbying furiously in order to stop. Well, they're lobbying furiously against any reform, basically, but particularly anything that even smacks of single payer. And it strikes me as just absurd that you see Obama and the public option being attacked as single payer when, if anybody has a criticism of it, it's us, who are real advocates for single payer, because it's not going to solve, just having a public option is not going to solve the fundamental problems with our health insurance system in the United States. And the reason it won't and cannot is because it doesn't address the causes of the problem. And I would categorize the causes of the problem of our healthcare system as follows: that basically any system that retains a private health insurer component for a significant proportion of the population necessarily means five things. First of all, some consumer dollars will necessarily be going to private profit and executive salary overhead, which you do not have under a single-payer system. Secondly, since insurers have a profit incentive to avoid paying bills, more of our healthcare dollars are consumed by red tape, administrative barriers, battles and appeals over what's going to get covered and whether something is going to get covered at all. With some of those costs then being foisted on the government, other insurers, healthcare providers, and patients when some patients are denied coverage. So that's another thing that helps drive up costs. Third, our healthcare dollars pay for functions that are essential to private insurance but are absent in public programs, such as underwriting, marketing, corporate services, advertising, etc., which account for about two-thirds of private insurers' overhead. Fourth, the efforts of private insurers to avoid paying claims, and again, their responsibility to their stockholders, that's what they do. They make more money when they avoid paying claims. Forces healthcare providers to spend hundreds of billions of dollars dealing with paperwork from the insurance industry. And the fifth factor, and this is kind of related to the last one, is the inherent expense of a fragmented payment structure itself. It's insane. There's something like 1,600 private insurers. That means from the standpoint of the healthcare providers, that's nationally. From the standpoint of the healthcare providers, that means they have to keep track of what's the rules for the varying co-payments, for the referral networks, which doctors on the plan, which not, what procedures approved, which not, for 1,600 plans. That's inherently expensive. And these are among the principal reasons why our healthcare system is roughly twice as expensive. We're spending about twice as much as most other industrialized nations, and yet we rank 37th in the world in terms of the actual caliber of quality of healthcare services that are provided to our people. But perhaps most important is the effect it would have on businesses and consumers alike. Instead of, the average premiums in Illinois right now, the figure I've seen, family premiums in Illinois average $13,631 a year. That's for those who are insured through their employer, which is about the annual earning of a full-time minimum wage job, just going to health insurance, okay? Now, instead of businesses struggling to pay that kind of money, and it's going up far faster than the rate of inflation. Since 2000, those premiums have increased about 89% in Illinois, just since 2000. You know, the inflation rate during the same period has been about 17%. So it's going up much faster than inflation. You're eliminating all that with single payer. Businesses are no longer having to pay through the nose to try to provide their employers with health insurance. Consumers will have more money in their pockets. Businesses will have more money in their pockets. That money gets spent, and there is your economic stimulus. So when we're talking to people about single payer, it's not simply a good idea. It's not simply the moral thing to do, although it certainly is that. It is not only a way to get to a healthier, better quality of life for our society, it also makes damn good economic sense at a time when our economy is struggling.